Today, I wear the hat of moderator, and I'm very excited to welcome the panel up in just a second. One thing that I'm really pleased to see is the important role that diagnostics have been given in this session. And in the concept notes that's part of the program, there was a statistic in there which was 47% of Africans have little or no access to diagnostics. So I did some calculations in my mind. And that is the equivalent of saying the entire continent of Europe does not have adequate access to diagnostics. So that's the context that we're going to be having this conversation in. That's the landscape. And to discuss it, I would love to welcome up our panel, Dr. Alan Pamba, Dr. George Uduku, Ms. Nana Asante, Ms. Maureen Mate. Welcome.
Good morning. So my name is Dr. Maureen Mate with the Ministry of Health. I head the bilateral resource mobilization units of the ministry. And as a ministry, it's obvious we have that mandate to ensure the health of our women and children. Thank you.
Good morning. My name is Nana Asante. I wear many hats. The first of which is that I'm a nurse. My clinical experience is in women and children health. I'm also the current board chair of Adensin and Midwifery Council. I also have a medical supply company, and we're in the process of setting up a manufacturing plant, so I'm very excited. One day to manufacture diagnostics. And then lastly, I'm also a breast cancer survivor. Fortunately for me, I didn't have the challenges that women in Africa and low-income countries have. I had access to all the diagnostics. I had access to everything. So moving back to Ghana, you realize that it's almost like a day and night situation. So I founded Embrace Society. And what we do is we create awareness, we offer support, and we advocate, like what's happening in here, to ensure that women who are diagnosed, who have concern, have access, timely access, with all the right diagnostics, with all the right support, with all the right treatments, so that their outcome could be like mine.
Good morning, everyone. I am Dr. Alan Pamba. I am the Executive Vice President for Roche Diagnostics in Africa, based out of Nairobi, Kenya. Delighted to be here, delighted to be part of this panel. Now, at Roche, 2.5 years ago, we built a big diagnostics ambition for Africa. And in this ambition, we want to increase the number of tests we bring to the continent tenfold. We call it the 10X strategy. We estimate that in 2021, we were reaching 50 million Africans with our quality diagnostics. We want to elevate this to 500 million Africans by 2031. This is a strategy that we're driving across the continent. Now, specifically within that 10X strategy, there are interventions that we expect to impact women's health significantly in the continent. One is expanding access to HPV DNA screening. We believe that cervical cancer is something that Africa can eliminate, especially if we work together. We actually are talking to MSD, who do fantastic work with primary prevention, and other stakeholders, so that we can tackle at least that one cancer. Second is the area of blood. Now, Africa has about a 60% gap in achieving its blood needs. And Roche has fantastic blood solutions. We're working with various governments to set up blood banks and improve safe blood for Africans in Kenya. As we know, we're still losing millions of women in childbirth, postpartum hemorrhage, which we shouldn't be doing this age and time. So again, as we work towards our 10X strategy, we're very hopeful that we can deliver that. I have to make this other point, just in touch with the theme of this conference, and it's really important. And it's the fact that I have, as the head of our Africa organization, Diagnostics, a very specific objective every year to achieve 50% of my senior leaders being female. It's my objective. I have to deliver it. And I'm very pleased to say that today, 53% of our senior leaders in Roche in Africa are female. And they will deliver the 10X strategy. Now, why is this important? I'm a big believer that if you don't have a seat on the table, you're probably on the menu. And this is a clear distinction. I'll be very brief, Naeem, but give you one story. When I joined Roche, I met a fantastic female leader, our general manager in East Africa, Jackie Wambu. Unfortunately, she's not here. And she told me a story that made me realize, wow, it is important to have women in positions of leadership. Kenya was about to introduce reimbursement for cancer. And the question was, which cancers do we reimburse? The head of the National Health Insurance is a man. And majority of the leadership team there were men. Guess which cancer came first? Of course, prostate cancer. Policy change in weeks. Jackie had a very good solution for breast cancer. Roche has fantastic medication for that. The immediate answer was no, we need the evidence for cost effectiveness. The stakeholder management took more than 1.5 years. But being a woman, she understood this and she was resilient. And she was on that man's door every day. Breast cancer is reimbursed today in Kenya. But it didn't need to take 1.5 years, and if we didn't have Jackie, that would not have happened.
Awesome. Thank you, Alan. Good morning, everyone. My name is George Uduku. I'm the General Manager for GE Healthcare West Africa, and I'm based in Lagos, Nigeria. At GE Healthcare, we are committed to advancing women's health through cutting-edge technology, research, and education. Specialization is around advanced technologies, imaging technologies like mammography systems that aid in the early detection and management of breast cancer. Our Volusin ultrasound portfolio is tailored to obstetric and gynecological case management. We also have densitometry systems that aid in osteoporosis assessment. And then we have health informatics solutions that aggregate patient data for clinical decision support. So that's what we do.
Thank you so much. Thank you. Daniela, I do think we have the right experts for solutions. I think we're good to go. So interestingly, we seem to have the private sector on my right. And I guess you'd be a blend, but yeah, but maybe we can, for the analogy, have the public sector on the left, and this was unintentional. So let's see how we can get started with the discussion. Today, the conversation that we're looking to have is about the role of diagnostics and how it is an enabler for advancing women's health. But the theme of these conference series is always about partnerships, collaboration, and the intersection between the private and the public sector, which is currently me sitting in the middle over here. So we would like to kick it off. I'll start with yourself, Dr. Pamba. We heard from Dr. Muriku earlier around the diagnostics gap. Some very interesting statistics there, especially when you look at the primary health care setting, considering a lot of service delivery is provided through that channel. So do you see that there are solutions in the private sector to help close this gap, specifically focusing on primary health care as well, please?
Thanks for the very good question, Naeem. The short answer is yes. Today we have technologies in diagnostics which have advanced quite fast, I have to say, in the last couple of years. But we have technologies that can provide solutions to 70% of all clinical decisions with precision. The technologies are there. Now the question is, are they there in Africa? And the answer is no. And what sits between those technologies in factories and Africa are the numerous hurdles to access that we see across the health spectrum. So those need to be addressed. But I have to underscore the fact that the gap, the diagnostics gap, is actually bigger than 47% that you hear. It's probably closer to 80% if you think about access to quality diagnostics where you get one test and it doesn't need to be repeated because the physician or the caregiver is doubting the quality of that test. So we still have quite some ways to go before we can access this across the board. I work in the area of in vitro diagnostics, so this is where you get either blood tissue sample and process it. We make the big machines that you see in your typical lab. And the spectrum from in vitro diagnostics right to imaging, where George is, GE, Siemens, and others, the technologies are there. And the discussion now we need to have is, do we value what we can get out of diagnostics? And how do we then cross the access challenges that we need to address?
Thank you. Thank you. So I'd like to pose my next question to Dr. Uduku. So we've heard that there are solutions out there. And practically any events that you go to in Africa, you will hear talk about partnerships and collaboration as a means to get these solutions out. So, as Dr. Pamba has just highlighted, we still see that there are barriers. Could you comment on what we can be doing better from a collaboration perspective to improve access, right? So we think about government agencies, healthcare providers, the private companies that are all involved in this space. To Daniela's point about solutions, do you have any recommendations on how collaboration can be better utilized?
Absolutely. Thank you for the question. Look, when you think about this question, right, a couple of key success factors comes to mind, the typical ones, right, around, establishing, governance systems, proper governance systems, sanctity of contracts, having clear objectives with clear and open communication. But I want to draw attention to some salient issues which we experience, right? First is the discipline of project development is often neglected in our environment, right? We observe this a lot. It is critical when establishing new medical facilities to hire competent consultants and conduct thorough due diligence that address questions around the clinical needs, operating requirements, resource requirements, and risks inherent in establishing the clinical services in that particular catchment area. This is absolutely critical. Unfortunately, we've heard stories of state-of-the-art ultrasound systems that were delivered to facilities and could not be used because you can't have a woman lie down on a bed in a room with a leaking roof, right? So that's the first one. Secondly, public authorities need to pay closer attention to health service planning. It is also important in that regard to ensure that private sector is fully integrated in health infrastructure planning and rollout. Now, ideally, no medical facility or no private operator should be allowed to establish a medical facility in any location without a so-called certificate of need. And that certificate of need is a public document that specifies what the service and infrastructure targets are for a particular catchment population given their health profile. It specifies what the current supply is based on the availability of facilities. It specifies what the projected supply is based on the number of license applications that are in progress. And it confirms that there is indeed a gap, a service or infrastructure gap that needs to be closed. Now, without that document, private operators should not be allowed to establish healthcare facilities. This is the way you ensure that you have equitable distribution of clinical services across the region of the country, right? And you observe examples when you look at the distribution of prenatal services, for example, right, between urban and rural areas, or even between urban areas. So in Nigeria, a Lagos Abuja versus a Maiduguri, or in Ghana, an Accra versus Boltanga, right? Now, the third is around health insurance. Now, our governments are investing a lot of money lately in both in Ghana and Nigeria on medical equipment, right? That's all well and good. Look, I'm not complaining. It helps my business. Don't get me wrong, right? But let's be honest with ourselves, right? Without addressing the issue of health insurance, you have an affordability problem. And until the affordability problem is addressed, girls and mothers will continue to drop out of the various care pathways for women's health. And we would have spent several $billions and would have achieved nothing in terms of saving lives, right? there are smarter ways to deploy public funds. Public authorities should focus on expanding health insurance and let private sector invest in medical equipment and medical infrastructure. I am a firm believer that there is a bigger business opportunity in providing a clinical service than in supplying medical equipment. And Alan and Claire, I don't know if you'll agree with that or not, right? Okay. And look, to be honest, under the right conditions, manufacturers like GE, Canon, and Roche will be willing to share the risk and reward of service provision. Health insurance is the only way you can guarantee access to a sizable referral base that can afford the service and guarantee returns to the private investor.
Fantastic, very powerful. Thank you. Thank you so much for that. And we're going to segue nicely to the left here, but I wanted to remind of a comment that we just heard in Dr. Muriki's presentation. I wrote it down. It said, when an issue is a global issue, Africa gets forgotten. And I think as we're having this conversation, and it's great to hear the role that international companies are playing, we also want to think about the local industry as well. And we see a lot about local manufacturing for vaccines and medicines taking place, policy and so on and so forth across Africa, but not yet diagnostics. So in your opinion, what is needed or what can be done to help grow that local industry? Any perspectives on that?
I think a forum like this is one of the first things that we need to put in place, because everyone who's at the table speaks for their own interest. So if you're talking about COVID and we're talking about vaccine, the people who will be at the table are the ones who are speaking for vaccines. Meanwhile, you need diagnostics. You need to be able to diagnose the person with COVID before you can treat the COVID, right? So for me, it's about having the right people at the table. At a conversation like this, what's the takeaway? After we leave here, where do we go? And where do we go with that information? It's to go to the health ministries. I'm going to straddle both sides. Go into the health ministries. Go into organizations like PATH. I was doing some research, and I realized that PATH has an initiative called BLISS, and it's to boost local strategies that increase supply. All right. What I love about them, as somebody who's just gone through the process of setting up a manufacturing, the challenges that I had, nobody wanted to touch me initially because it was called a greenfield. So that means anybody who wants to set up a new diagnostic plant, no one is doing it. Ghana, at this level, Ghana imports 98% of all medical devices, and that includes diagnostics. So if somebody's going to set up that manufacturing plant, it will be a greenfield. Who's going to look at that person? Who's going to give that person financing? We talked about having the right people to put the systems in place. If we haven't done it, do we have the expertise? Is somebody in Ghana who's capable of running such a facility? So we can't do it even at the local level on our own. WHO has a regional strategy. There's AFTAG. Ghana, at the local level, we have 1D1F. There's a lot of manufacturing companies that are coming forward. Government gives you initiative to set up manufacturing, right? Nobody's talking about diagnostics. Nobody's even talking about devices. So for me, it's about all the different players, because one person, Ghana government can't do it on their own. We don't have the expertise. Me as a business person, I don't know the first thing about running a factory even, except that I believe it has to be done. We have to do it on our own. I import everything that I sell now, and I've felt the pain during COVID. So for me, AFTAG is an amazing thing. Once you get the certificate of origin in the country, you have access to 1 billion people. But because it's not something that we're doing, it's better that all the players, all the Rushes, the GEs, the PATH, the WHO, come to the table with a real intentional goal, which is to leave that table with clear pathways as to how everything that was discussed will be implemented. We hear a lot of these things happen, but what is the takeaway? In 2 years' time, in a year's time, when we have another sitting like this, what tangible things in terms of making diagnostics accessible to African women? What has come out of this? I want to just quickly touch on what you said about health insurance. As Embrace, we're heavily supported by Roche. We have a patient navigation system in 13 hospitals across the country. Ghana Health Insurance pays for chemotherapy, aspects of the chemo. It doesn't pay for the biopsy. It doesn't pay for the diagnostics. So if you sit at the table and you talk about health insurance, if you don't diagnose that woman, how is she going to have access to the chemo? What she will do is go away and take care of her family, because at that moment, that's what's important to her. So let's get all the right players. When you're talking about health insurance, bring the players, bring the women themselves who have gone through it. Learn from their experience. Bring the healthcare professionals who treat the women. Learn from that experience, so that when you do end up with that healthcare insurance, it's a comprehensive one. It's not because the people at the table were all advocating for their individual interests, but what is the collective interest, especially when it comes to women's health.
Thank you so much. Thank you so much. So what we've heard so far is there are solutions. There is a need to collaborate. We've heard on some very specific elements like health insurance, but we've also understood the importance of bringing the right people to the table. So, Dr. Mate, as we've heard all of these perspectives, Mr. Sante also mentioned the government cannot do it on its own. However, the government can still play a very important role in this ecosystem. So I would like to turn to you, please. What do you see that Ghana has done or perhaps plans to do in order to create this enabling environment for the private sector to play a more prominent role?
Okay, thank you. So I think I'll begin from where she ended on the issue of the National Health Insurance scheme. We have a National Health Insurance scheme, which is kind of a social health insurance, and so it doesn't cover everything. We've tried to pick the burden of disease that we have and tailored the benefit package towards that. And reimbursements are done based on the services that are provided, and so management, diagnosis, and medications. But also, as she said, it doesn't cover everything, and so there are some diagnostic services that may not be covered by the health insurance scheme. And I agree, there's a need to have that discussion around possibly scaling up some of these interventions within the benefit package. But that also boils down to, do we have the funding to take care of those if we add on embedding the health insurance scheme with that? We've made the environment friendly for the participation of the private health insurance schemes, and I think it's one way of collaborating to ensure that there is financial access to healthcare within the country. Additionally, I think she also talked about the health industry and the issue of vaccine production, which Ghana is going into now, and so the discussions around bringing on board diagnostics is something that as governments would also have to consider, especially if we look at the low-lying ones like the rapid diagnostic test, which wouldn't take much investments to introduce. It would push us a long way in improving the diagnostic field. Yeah, thank you.
If I completely paraphrase, what I'm hearing is there are things that have been happening, but you're also open to introduce new things going forward for this conducive environment. And here today, we are here to find solutions and leave with a tangible action plan, right? So, Dr. Pamba, if I could turn to you, if you have any recommendations for the public sector, for government, about what else can be done to create a better working environment, a more conducive business environment, what would those be, please?
Thank you, Naeem. I'll be very specific, and you'll find me paraphrasing some of the stuff that colleagues here have said. Two things. One, we have belabored it, health insurance, and two, the regulatory environment. Regulatory environment so that we don't have to file in 54 countries a new product. It delays patient access. Something filed in Nigeria, recognized everywhere in the rest of Africa. This is important. But on the topic of health insurance, let me give you a very specific example. A part of my team and I have been in Nigeria the last 3 days. We've met different stakeholders in Abuja, in Lagos. What have I learned? A population of 220 million. Insurance coverage, health insurance coverage, not more than 7%. Nigeria loses about $2 billion to medical tourism every year. That money goes out. Yeah. And this is not a beef, Pam and Claire. This is stubborn facts that I saw, and I felt, wow, we need to change this. That 2 billion could be kept in the country. How do we achieve that? If I look at that country, there's a market failure. There's no health market. You know, there really isn't a health market. Yet there is a lot of money going around, but going around inefficiently. The challenge, same to Nigeria, to many African countries, is governments have done the same thing since independence, 50 years ago, when government was the payer for healthcare and also the provider of healthcare. We have reached a space where I don't think government should be a major player in healthcare delivery. Government should be a big player in ensuring that there's a health market, that people can pay for healthcare wherever they are, wherever they choose to, which is the health insurance story. If you ensured that every Nigerian walked in their back pocket with a health insurance budget and could choose where they get care, hospitals will come up that cater for all levels of need, and the government's role would be to regulate them and to drive equity. What George said is what I saw. New hospitals being constructed by the government, machines donated by donors, filling the hospitals to look good, you get a photo op, and that's the last you see of it. The machines stop working, the donor can't service them, they end up in the backyard. So you see a graveyard of dead instruments in many African hospitals. Leave that to the private sector. Focus on creating a health market. The rest will sort itself out. I think this is a clear message that I would send to governments. You know, glad a few people agree with me. This is the radical change that we need in Africa now. You can't talk about universal health coverage without universal health insurance. It's a pipe dream, you know. And there's too much distraction in playing on both sides of the divide. Focus on just creating a health market, making sure that the system is organized and people can be able to pay for their health care with dignity.
I think we need another round of applause for that one. That's a very radical suggestion. My colleague from IQVIA here tells me that when I get nervous, my accent becomes British. So you might hear a change a bit. This is a very nice, ambition to work towards. And let's say until we get to that point, there's a role for that public-private partnership. And of course, further down the line, that is also one of the modalities through which transitions can happen and so on and so forth. But Dr. Duku, I'd like to turn to you for a second, please. Specifically focusing on public-private partnerships, are we seeing promising things in the space of diagnostics that can give us hope, or are we not seeing enough yet?
There are a few great examples, absolutely. In Ghana, in partnership with the Ghana Health Service, we deployed 500 handheld ultrasounds, across community hospitals across the country, right? And with this, we're able to screen prenatal cases and identify early complications of pregnancy. In Nigeria and in Ethiopia, we're partnering with foundations to provide training to midwives and nurses on the use of advanced technologies, right? We've rolled out this program, 20 of such programs across 7 countries in Africa. We've been able to impact 150,000 lives, mothers and newborns. We've trained about 1,500 health workers. We've been able to achieve improved utilization of health services, improved case management, and referrals. So there's some great examples, absolutely. But some of the most important work that we're doing at GE today is around our one-stop breast clinic. Now, if you look at the traditional pathway for breast cancer diagnosis, you find a couple of problems, right? So traditional diagnostic pathways for breast cancer results in a lot of waiting time, long waiting times that delays diagnosis and treatment, right? And of course, this negatively impacts on survival rates. Now, you also find that women have to navigate multiple appointments, across a very widely dispersed facilities, right? And this is a highly fragmented and inefficient process, okay? And the result of long wait and delays is increased anxiety and stress, for women, right? So with the one-stop breast cancer clinic, we integrate all the diagnostic services, mammography, ultrasound, biopsies in a few visits, and we can shorten the time to diagnosis from weeks to hours, right? By centralizing treatment and diagnosis and treatment, within one location, we ensure access to better coordinated care, right? And this, of course, streamlines the process and improves the quality and continuity of care, right? And the fact that women wait a lot less means that, there is no anxiety, there's no panic, and they have quicker access to supportive healthcare and ultimately improved health outcomes.
Thank you. Thank you. So I think what we've heard is some interesting ideas about, if I may call it, the liberation of the private sector. And we've also heard some nice examples of successful collaborations. And so, Dr. Mate, what we're hearing from this side is the private sector is willing and wanting to be engaged and believe they can contribute more. However, maybe it's not all as easy or pleasant as it sounds. Do you see any challenges working with the private sector?
Okay. So if I have to talk generally about private sector and not limit to diagnostics, I would say yes. From the ministry level, we have that challenge of who to engage and who to bring to the table. And I think it was clearly mentioned this morning, if you're not at the table, then you must be on the menu. And so it's those that are on the table that actually take their decisions. But the private sector, sometimes you find that not very organized. And so it's difficult to pick who you are engaging. When it comes to policy development, sometimes it's easy because, if it's related to the laboratory group, you have to call somebody from the laboratory. But the broader policy decisions, sometimes it's difficult for us to pick who to engage, because there are several federations or associations within the country. And so that engagement has been going on, and it's something that we are grappling with. And I think if you're able to harmonize that environment and have that coordination going on within the private sector, like the Healthcare Federation has done, I think it would go a long way to boost the engagement with the private sector.
Thank you so much for that. Thank you. So we're about to head into Q&A in a few moments, but there's just one more question that I'd like to issue before we go there. So I think so far we've heard a lot of very specific things, and thank you so much, Dr. Mate, for sharing these with us. Perhaps as the conversation goes on in the Q&A, you might want to make some suggestions in response to the challenge that she's presented. But I would very much like to see if we can stay on Ghana for a second. Mr. Asante, if we look at our landscape, I asked the question to Dr. Duku about what brings us hope and excitement. From your perspective, what are you seeing happening in our country that is giving us hope for closing that diagnostics gap in women's health?
So I want to just start off by saying that the reason that we're all here, the top 4 killers of Ghanaian women are all reproductive. related, right? The cervical, the breast, the ovarian, maternal mortality. So it's almost as though being a woman is a death sentence, right? Through no fault of your own. So having a conversation like this, hearing that women's health is in fashion, is quite exciting to me. You talked about the fragmentation, having the Women Health Forum, just bringing all the various voices to the table is exciting. It's something that we don't hear too much of. Knowing that through persistence, you know, the woman's voice, when we want something, we push. If we're passionate enough about it, we push and we get things done. What excites me is that knowledge. Now, how do we translate it into action? And that's through partnership. Because one person, for the work that needs to be done, one person's voice is not enough. Partnership from the men who value women and our contribution to society, to the world. I always say that we are the neck. The man is the head, but we are the neck. When you wake up and you slept on the wrong side of the pillow and your neck is crooked, your head does not move. So it's in all our best interest to take women's issues at heart. So I'm very excited about this. I'm excited about the 1D, 1F and the facilitation that government, the enabling environment, the support now, the attention to manufacturing. I'm excited about the AFTAC because within, especially in Ghana, our market is small, but the Ghana FDA is strong. If you get Ghana FDA certification, it opens up the door to about 7 different African countries. That's a big deal. So having those initiatives in place for me is exciting. But the question is, what passion do we put behind it? Because sometimes you find that it looks good, it's pretty, the initiative is there, but where's the commitment? And the commitment comes from the passion. You know, the vision. Why did we even create it in the first place? Are we really serious about the outcomes that we claim we are? So just having the right people at the table, taking no for an answer, and knowing that if it goes well for a woman, it's not just for her and her family. We know economically when women are healthy, you have a healthier society. So the excitement of being in this room and how we can harness all the various voices, the various players, government, private, in between, everything, NGOs, everything else, and just keep pushing. Because even if you don't get everything done, something will be done. I had the privilege of speaking with the Director General of Ghana Health Service, and Ghana's finally going to start rolling out the HPV vaccine next year. Now it's been said, how do we push? Because we've heard it before. So he told me, but how do we make that? So now every time I see him, I will ask him. Next year is what, 6 months away, right? So how do those initiatives, hearing it and pushing it to ensure that it is done for me is exciting. At least we have a date now. And the fact that I don't believe that it's not affordable. When COVID came, Gavi came together and made vaccines free because it affected everybody and it affected men, right? Why, after all these years, with all the data, with all the lives, all the female lives that have been, even men, because male children also get the HPV vaccine, why are we still being told that it's too expensive? But yet and still, other African countries who have the same economies as we do are implementing it. So for me, the political will, the citizenry's will, and their knowledge of their power also pushes the button. So all these things and just collectively coming together for me is really, really exciting to know that with one voice, with a collective voice, things can happen. And I hope that next year, 2 years when we come, we'll have some concrete, exciting news to report.
Thank you so much. Thank you so much. Fantastic. Amazing. So we have roughly 10 minutes for Q&A.
Mine is actually more of a comment than a question. And I'd like to speak to, I think, Dr. Mate, and say it's very clear. You have the Healthcare Federation of Ghana. If you want to speak or find out who to speak to in the private sector, the Healthcare Federation is the umbrella body representing private sector within any country that has it. We are an advocate for everything that you need, and everyone that you're looking for, be they medical doctors, nurses, scientists, physiotherapists, IT consultants, in any area you're looking for, you need to just have the president of your Healthcare Federation by your side and say, who do I talk to? They will be able to bring the right parties to the table. So I'd want to encourage yourself in Ghana, and for anybody else, our ministers around the room, to please work with your Healthcare Federation and resolve a lot of these issues. Thank you very much.
My problem is the awareness COVID gave us, and what have we done out of it? It clearly showed global imbalance in services and supply chain in healthcare. We have about 340 women in Europe. We have about 340 million women in Europe, 750 million women in Africa. How many diagnostic companies are there in Europe for women's problems? Cervical cancer. How many in Africa? Zilch. Why is there that imbalance? And yet these same countries are setting up in Bangladesh, Vietnam, India, China, Malaysia. Why are they not in Africa? I think when we talk about partnership, we should walk the talk. We have to be intentional and purposeful. We're not being intentional, we're not being purposeful. And I think we also lack data in Africa. And even the private partners, the private potential partners, are not collaborating with each other. So GE is doing one thing, Roche is doing one thing, all in breast cancer. Why is Roche not collaborating with GE? And this is where the Coalition for Women come in. So I think that, you know, African leadership has to be purposeful, we have to be committed, and we have to be, you know, we just need to also finally define. We use the word partnership, partnership, partnership. Define what kind of partnership. We still haven't defined the kind of partnership. So that's my take. If we can leave here with a definition of partnership, commitment to work together, walk the talk, and give ourselves 5 years from now, these are going to be the KPIs we want to achieve, would be a better way, far better than we are today. Thank you.
Great question, great point, very passionate. I come from the place you are in right now. When COVID happened, we saw it. There's been a lot of talk about local manufacturing in Africa. There are two intentions with that. One is security of supply, and the second is value addition within the continent. Both very important. Reality, it's a harsh reality, but it is the reality. The world is economically in competition. We are part of that. We are part of that global competing economy. Nobody will set up a factory for us in Nigeria, I give the example, where there is no health market. It's not going to survive more than 1 year. So certain things that are happening in Africa, we must, as leaders, applaud and push. One is the establishment of the Africa Free Continental Trade Agreement. Moves us from being a single economy, $1 trillion, you know, in terms of GDP, 3 trillion actually, you know, huge. If we had open borders for people, goods, etc., that could potentially be a reality. This is important. And we all have a role to play in achieving this. Taking away inefficiencies, we've already talked about health insurance. If you look at the health sector, I really believe our biggest asset as a continent is people, you and me. But look at your government. How much of the health of the budget, national budget, goes to investments that speaks to you as a human being? Health, education, agriculture. Health is probably at the bottom of this. So we have 1.4 billion population. a potential demographic dividend that could become a demographic disaster if we don't really invest in the quality of our people. We see many Africans dying in the high seas trying to cross over. They're not healthy, they're not educated, they're desperate, looking for jobs. The few educated, healthy ones fly in and are let in red carpets. During COVID, Nigeria lost so many doctors, so many nurses to the UK, you know, quietly taken out to go and save people in the UK, you know. And this is all happening because we haven't come together. 54 borders are too many. We need to break those boundaries. And I think it's up to us, in whatever positions we hold as leaders, to advocate for Africa coming together and breaking boundaries as best as we can, which takes us to partnerships, which is really important.
Absolutely. Thank you very much, Alan. So let me just start from where Alan stopped, okay, and echo some of the things he mentioned. When you talk about local manufacturing, number one, there needs to be a guaranteed minimum scale that makes local manufacturing viable, right? We must have health insurance policies and coverage in place, number one, and we must have government regulation that mandates local purchases of the locally produced medication and devices, right? Alan touched earlier on regulatory harmonization. That has to be in place, right? So we need regulatory harmonization to streamline market access. We shouldn't be pursuing 54 different parallel license applications or product registrations across the country, right? And then the third point is we need to fix our customs procedures, right? We need to make the movement of goods in the context of AFTA and one market, right? We need to make the movement of goods between markets a lot more streamlined, right? On partnerships, fantastic question, and I'm really happy to announce to you that we've wised up GE and Roche, right? And we are piloting a partnership in Nigeria, actually, right? So I talked earlier about, you know, the one-stop breast clinic, right? So Roche makes the finest medications for breast cancer. GE makes one of the finest diagnostic technologies, you know, and we're partnering with a foundation in Nigeria to try to put all of these, integrate them under one roof, right? So diagnostics, insurance, therapeutics, all under one roof, right? Like I said, the whole idea is to reduce wait times from weeks to hours, right? Ensure that patients have access to better coordinated multidisciplinary care, right? That reduces their anxiety, reduces the stress, improves, you know, the pace of diagnosis and treatment, and ultimately improves outcomes. So we've wised up.
Fantastic. Okay, we have just 5 minutes left.
I like the points that we've made about manufacturing and local manufacturing. I'm Nigerian, so I understand a lot of the things that we've mentioned about Nigeria. Now, you see that in a number of the government hospitals and facilities, there are these equipments that have been donated by donors, by funders. A lot of times, these equipments are either not tailored to these kind of places, or the parts are just. So, for example, you get an equipment and it works for the first 6 months to a year, and then when a part goes bad, you cannot find that part again because either the funder is no longer in communication with them, or they just can't find that part around the country. So first, how are we able to sustain some of these equipments that we get from funders and donors? What are we doing to make sure that we're not wasting these funds? You go to teaching hospitals and you see that a lot of equipments are just packed up in the radiology department. They've been used for a couple of years, they're not in use any longer, millions of dollars down the drain. How are we sustaining this? And then the other thing is that we have a lot of organizations doing really great work, but they are doing this work in silos. And that's one of the things that's very key to us as AL for Health. But how are we ensuring that all the companies and organizations that are working in a particular area of health in Africa can work together to bring a more concerted solution to some of these issues? How are we ensuring, or how are we prioritizing that we are partnering together to bring solutions to some of Africa's most pressing healthcare challenges? Thank you.
I'm asking the question first because I'm a female, and second because I'm a youth. So I'm asking that in this conversation, I've heard a lot about the diagnostics, which is essentially very important, because if we don't diagnose, then we cannot treat. I'm just going to ask that in this conversation, where does the youth come in place? Like, where is our place in this? And looking around in this conference, I see that it's mostly those that are interested in this topic that are here. So how do we get those that are not informed, because you can't be interested if you're not informed. So how do we get these people that are not informed about this topic, so that they can get interested in it and want to hear about it? Because like it has been emphasized, we have a lady in our life in one way or the other, daughters, sisters, mothers, grandmas. So everybody has to care about this business of women health. And I also want to ask that how do we make this partnership between the entrepreneurs and the medical practitioners? Because the entrepreneurs will be looking at it from a business perspective. Okay, this is what can be done, looking at the possibilities. But the medical practitioners really see what is happening in the hospital. So how do we foster this relationship between these two parties that can bring health solutions to our everyday society? Thank you.
I have some comments and a question that I will direct to Dr. Marty, who I hope will be responsible for speaking for the rest of the public sector representatives in the room. My first one would be a comment around partnerships. So, George, you mentioned about this new partnership with Roche, but I'll tell you, in Kenya in 2017, there was a partnership between GE and Roche, and we're doing ultrasound-guided biopsies. You know, I'm pushing it to the Ventana. I think they were rolling out the Ventana at the time. But there was an issue around the rest of the financing. So you've talked about that NHIF, or I mean, Hospital Insurance Fund, covers one part. I would like to challenge us that, can we as private sector look into supporting ideation around how some of those other channels can be financed? So our governments, in as much as, yes, we're looking to have them create, marketplaces, we see the challenges. We see them ourselves as private sector. So, and we also know all the other players who are financing health. Can we not go to them and say, look, NHIF is only able to pay for the medication, the Herceptin, for example. Who is going to pay for their diagnostics? We also have had so many local innovations around microfinancing for health. I am sure if a package is prepared properly, we have the numbers of women in our countries who need these diagnostics. The Ministry of Health, in charge of resource mobilization, if you're able to go to all the funders, Bill and Melinda Gates and all the other partners who are willing to support women's healthcare in Africa, and say, in Ghana, we have 20,000 women who need diagnostics every year, and it's going to cost $50 per woman. And for sustainability, we're also going to add one or two other things, and you come up with the number, and that is the funding that will be used to support all these other services that are needed in addition to the medication. The solutions are there. I think we just need to move forward. And I'd like to make a contribution maybe to Daniela, that the next conversation we need to have as HB or as Coalition for Women's Healthcare is the point that Dr. Pamba has made about the role of government in creating health marketplaces. Private sector has been shown to have the most innovative solutions for healthcare delivery. We are not discounting public sector, but here we are, 50, 60 years after independence. And you're right, some of the things we're discussing, we have made progress, but it's too slow. How do we accelerate? How do we move faster? As the Africa Health Federation as well, which is, the middle ground between public sector and private sector, can we get to that point where we are saying, where can government most efficiently use the limited resources they have, and then bring healthcare to the table? Don't quote me here, but as Kayagen, if we are asked, okay, you bring $1 million, Roche maybe 10, GE maybe 20, and you have a basket of funds where you come with, $50 million, that says, with this $50 million, we are going to address this gap that is not being addressed by public sector. That's where we are working hand in hand, and having in there credible consultants or people who will then also advise us on sustainability and the efficient use of funds. I'm not throwing it back to our government, but we also know that sometimes we're not the most efficient in spending of these funds. So, Dr. Maki, now to my question. Are you able... Would you be able to be an advocate for this private-public discussion around how does government create this marketplace, and how do all these private sector people help you to deliver the best care for the women of Africa? Thank you.
I'll start by just giving a background. So access to healthcare, specifically diagnostics, sometimes is limited. For women, is sometimes limited by challenges that are unique to women. For example, if you're talking about marginalized community, sometimes access to healthcare is limited by challenges like distance from the health facility, because we know that the woman is taking care of the family, and if you have young children, they might not go to the health facility to get the right care. So to the policymakers, how are we ensuring that we are incorporating the women's voices, experiences, and challenges when we are coming up with the policies that impact healthcare for women, but also when we are allocating funds for healthcare for women? My last comment on the partnership that we are talking about, I learned recently that the new way to compete is to collaborate and to partner. So all of us, we have to come together, the industry players, we have to come together through maybe the Healthcare Federation, because sometimes it's not easy to engage directly, but also the NGOs, government, we have to come together to put together our effort so that we can have an impact that lasts in Africa. Thank you.
Thank you. Thank you, Naeem. I know Naeem is telling me and everyone that there is no time. Please bear with me. So we have been told that there is a disease burden. I think Naeem said as good as Europe's women. That's the kind of disease burden we have in Africa, 47% from the previous presenter. And then we've been told that solutions are available. But then between the solutions and this market, this disease burden of women, there are bottlenecks. And I hear bottlenecks like financing, I hear bottlenecks like regulations, etc., of many forms. Here we are as private sector. What are we doing about it? You know, we keep on using the acronym PPP, public-private partnership. When are we going to say private-to-private partnership? That is my problem. My problem is we want to always say, oh, the government or the public sector is not doing X, Y, Z. What are we doing about it? When is Roche going to come and sit with the Healthcare Federation of Kenya and say, ladies and gentlemen, we have this product. Who are your regulators in the health insurance industry? Can we sit with them? Can we then devise a pricing mechanism that they will be able to pay, and we can give these diagnostics to the women? We can give this medication to the women. All I hear is, how are these regulations going to be changed? How can a single trade area, single customs union, all these things, we need to get this done. How long will we wait? Every country has elections, X number of years, and a new government comes in and people lose track. But here we are. We have people here who have worked for 25, 30 years in the healthcare industry, in the private sector. What are we doing about it? We are not changing. We're still here. We know the disease burden, and we know what needs to be done. So I think my question is for us to reflect, and also to the manufacturers. Sorry, I'm putting you on the spot, but you are wearing those caps. How can we work together as private-to-private partnership and not the other way around? I think if we make that change, the public sector will start seeing, and they will always see that the train has left the platform. We need to jump onto it. Thank you so much.
I have a quick question surrounding clinical trials in the region. Now, we know the inclusion of women in clinical trials wasn't a topic of discussion until 1993. So there's now this big push to include women in clinical trials. Now, our counterparts in the APAC region have been admired and praised for their participation in clinical trials. It's not a surprise for them to have publications with the inclusion of a cohort of 300,000 people. And that's because they have the power of a large population. Now, we have that same advantage here on the continent. So my question is, what do you perceive to be the challenges in terms of the participation of Africans in clinical trials, and what can we do to change that narrative?
To wrap up the session, I'll give the microphone to each of the panelists. I'll do a very, very quick recap on the key themes that we heard in the questions, and in your wrap-up, you may address the components that you feel you're best placed to comment on. So we heard about ensuring sustainability of diagnostics. We heard about youth engagement. We heard about exploring innovative financing. We heard about the efficient use of funds by government. Dr. Mate, there was a particular prompt for you on your role in advocating for the PPPs in the health market. We heard about incorporating the woman's experience into the design of solutions. We heard about the private sector taking more ownership and forming private-to-private partnerships. And then finally, on greater inclusion of women in clinical trials.
So I have always been an advocate for engagement with the private sector. And so I'll say yes, I'll do that, yes. And then there was, I think there was something on diagnostics within health facilities that break down. And so one, I would say, one issue is poor planned preventive maintenance culture within some of our health facilities. And so that ends up with equipment breaking down without being serviced. And the other components are donations that come in that may not be to the requirements of the country, but you are kind of forced to accept them. And so they break down and there's nothing you can do about it. There are no user manuals to them. And so there's that challenge of how do you provide guidance on receiving equipment donations from donors and the rest. That is also. And the last issue on clinical trials within the African region. I know the malaria clinical trials were run in the African region, and so these are the lessons there that we can learn to scale up to other clinical trials in other areas. Thank you.
Okay, so I'm going to speak to the youth engagement. I am very excited to hear health-related question coming from a youth, a young person. Because I read recently that 1 in 4 people in the year 2020, and this is coming out of New York Times, will be living on the African continent. So all the decisions that we're making is going to affect the young people, the world actually. So it's important to have young people at that table when we speak. I wear many hats, like I said. When you spoke to the healthcare professional, also as an entrepreneur, we bring a different set of eyes to the table because you've actually worked in that environment. You've actually experienced it. So when you're coming in as an entrepreneur, you're not just in there to make money, but you're in there to actually solve problems that you have seen. And I'm a firm advocate about challenges being opportunities. We talk about all the problems that Africa has. It opens the door for opportunities, you know. So bringing the young people and letting them know that health is business. Even within Ghana, the healthcare industry is over $1 billion, right? So where do you find yourself? I think we talk about innovation. Innovation has to come from Africa. When other people innovate for us, they go into patent. It takes years. It takes years for that to come out of patent before we can start manufacturing it ourselves. If they choose not to come to Africa, how are we going to manufacture if we don't have access to the designs? So it's important for us to take healthcare and this conversation to the young people so that when they're thinking creatively, they add healthcare to that table. You asked about one thing that I'm excited about, and I forgot to add my own story, right? I'm excited because something that no one thought could be done. When I started my business and somebody said, go into manufacturing. I have no clue about it. But I said, why not? But because we didn't have that skill, I was advised to get a technical partner. When you started talking, the technical partners are where? In the Muslim, India, in China. All everybody wanted to hear was, oh, be my distributor, be my distributor. I was like, no, you had to start from somewhere. How did you start manufacturing? In this day and age, it's all about the machines. Why can't I bring the machine here and bring it? And it was just that persistence. And more importantly, to push and show that we can do it. We're no less intelligent. Part of our problem is that we don't believe that we can. So we need Africans to show that Africans can do it, to be able to motivate, especially the young people. And we need to start talking about and celebrating African successes. You know, I recently went to a farmer conference, and it was, all the awards were, you know, Indians. And I don't mean we have Indians who are Ghanaians, but most Ghanaians, when they see an Indian person, they don't see that as an Indian Ghanaian. What we're reinforcing is that only they can do it. So I'm where I am. I'm at the brink of starting a syringe manufacturing company. I still don't know how to run the company, but I'm going to run it nevertheless. And so let's mentor our young people. Let them know health is not sickness. Health is wellness. Even the wellness industry is a huge money-making industry. So let's make our young people to realize that healthcare is a business. There's money to be made. And you can do that and still make a good impact in your country. So those of you, the big companies that are innovating, I think it's important to reach out to the young people, bring them into the fold, and teach them how to also design and to innovate. So whatever design is done by Africans, for Africans, and we don't have to wait for years for somebody to give us the permission to be able to manufacture on our continent.
Just on the theme of young people, it's important. Increasingly, I realize people around me are getting younger and younger. And actually, I'm getting older and older, which is scary. And my biggest concern is, do I pay enough attention to them? Because, you know, sometimes you look at them as they have no experience, they have no idea what they're talking about. Yet here I am planning 10 years ahead for a world that is not my world. 20 years ahead for their world. So concern is, do we know when to get out of the way and let them lead? I think this we all have to reflect on. It's not an easy thing to do, but Africa needs that. Our average age is 20 years in the continent. You know, technology is moving very fast. The internet is a great equalizer. There are kids in Africa making tons of money, similar to their equivalents anywhere in the world. They are the future of the world. Are we giving them enough chance? Data is going to be currency, as they say, is the future oil. Is Africa organizing itself to generate and own its data in the future? We talked about research and inclusive research. In the area of clinical pathology, now there are algorithms, AI algorithms being developed with machine intelligence. So you've got a panel of, say, 7, 8 pathologists across the world, the best. A pathology slide is prepared, fed into, you know, their laptops. They read it. Their reading is fed into the machine. A consensus is reached, and the data keeps getting fed into the machine. Where this is headed, the machine will be better than the person. The problem we have as Africa is our data in there? Will that machine diagnose us the same way it's diagnosing a European or an American? Yeah. So we have a responsibility to try and catch up with that. I think it's our young population who will help us get there. On the graveyard of instruments in the back of hospitals, I think it speaks to the point we made earlier on. Government has no business being the major player in healthcare delivery. Private sector hospitals, how often have you seen graveyard of dead instruments in the back of private hospitals? You won't. Kenya just came out of a very long, protracted doctor's strike, weeks on end. Doctors are on strike, patients are dying in hospitals, negotiations are going on for weeks on end. When did you last see a private sector hospital with doctors on strike for weeks? It'll never happen. It'll never happen. They're losing money. They're going to fix it quickly, you know. So we need to get government focusing on where it makes the biggest difference. Create the health market and regulate for equity. Let the private sector players cover the role.
Thank you. So look, in closing, I want to touch on three questions, right? The first one was around sustainability. And I think this speaks to a point I made earlier about the discipline of project development, right? When we plan these initiatives, it's essential that we have the right people around the table. We must hire competent consultants, competent advisors, and ask critical questions around need, around operational requirements, resource requirements, risks, and mitigation. We must do that. Our planning must be a whole lot more holistic than it is today to guarantee sustainability. That's the first point I want to make. Jacqueline, you talked about funding, right? Look, I'm a firm believer that we don't have a funding problem in Africa, right? And let me explain what I mean. We are awash with capital, we are awash with funding, but our investors want to deploy funds in projects and programs that are bankable, number one, right? And development partners want to support initiatives that actually generate outcomes. So if you think about the work we're doing with Roche, for example, in Nigeria, all of that effort, the pilot, is to prove that if you integrate diagnostic and therapeutic services within one location, you can actually reduce wait times. You can actually improve clinical outcomes, right? And we take those proof points and we look for money, right? Capital in Africa follows bankable projects that actually deliver outcomes. That's what I believe, right? And then to the point around private-private partnerships, Claire has been very quiet in this discussion. I like a word which she coined a couple of years ago. It's about co-opetition, right? There's a time for competitors to compete, and there's a time for competitors to collaborate. So she talks about co-opetition. And look, perhaps one of the best examples in our environment in recent times has been the Catastrophic Health Fund, right? And look, I think you're best positioned to talk about the Catastrophic Health Fund. Please give her a few minutes to talk about the Catastrophic Health Fund.
We have a huge disease burden for cancer in Nigeria. And unfortunately, most people present late in stage 3, stage 4. We felt that it is impossible to just continue to watch and see disaster happen. So 4 companies, competitive companies, GE Healthcare, JNC International, Tanit, and Roche, all came together and decided that we would do a business plan. No, sorry, we'll do a business case. We put 10 million naira together with the IFC, and we went to PwC and did a business case. We did that and worked alongside all members of the private sector through the auspices of the Healthcare Federation of Nigeria, where then I was the pioneer president, and Mrs. Dr. Pamela Ajayi is the president today. And with our advocacy alongside CSOs like one of the first ladies, we went and lobbied the National Assembly. We got a no the first time. We went back the next year. We got a no the second time. We were told we were budget padding. But at the end of the day, we got in excess of 1.7 billion naira allocated. Today, this fund, where competitors came together for the national good to be able to make an impact, is providing cancer care to indigent patients for breast cancer, cervical cancer, and prostate cancer. And of course, now, success, it belongs to everyone. We don't mind. We're in the background. Whoever wants to own it, let them own it. But we also went the extra mile to ensure we put in operational guidelines. We went back to PwC, got the operational guidelines so that 95% of that fund is used for the patient. I mean, it's a point of pride. But for all of us to come together, nobody asked us to do this. We did this on our own. Collaboration does not mean that collaboration is one thing, but co-opetition brings out a whole lot more. When the private sector bigwigs come together and look at the problems and solve problems together, we are solution providers, and it can be really not just catastrophic care, but catastrophic advantages for the country. Thank you very much.